Hello, hello. Welcome to our summer seminar from Zero Hunger Academy and the Congressional Hunger Center. We're so glad you're here today. We're getting started. We'll tell you a little bit about our summer seminars and Congressional Hunger Center, and then we'll get started. But we're glad to see folks joining us. My name is Liz Pierce, and I am the Partnership and Outreach Manager at the Congressional Hunger Center. Welcome to our first seminar of the summer. In just a few minutes, I'll introduce our speakers to you, but first I want to share a little bit about the Hunger Center and Zero Hunger Academy. The Hunger Center was founded over 30 years ago and with the express purpose of developing leaders to end hunger and fight food insecurity. That remains our number one goal today. We have fellowships and internships running year-round, and we place our fellows and interns with hunger fighting organizations across the country and across the world. So the reason we do this is we want our fellows and interns to gain firsthand knowledge of what's going on around the country, in our communities, and around the world. We offer professional development seminars such as these and mentorship along the way. We now have over 700 alums of our programs, and a majority of them are employed in hunger fighting and poverty fighting organizations. Zero Hunger Academy is our online hub for education and online advocacy, and is the home of our online curriculum, such as the End Hunger Challenge and many other wonderful resources that you can find online. Over the course of the summer, we will offer 4 more seminars about topics such as the root causes of hunger, informed advocacy, storytelling for effective advocacy, and hunger and international development. You can visit our website, hungercenter.org, to learn more about our programs. But for now, let's begin our seminar. Today, we'll be talking about giving you an introduction to domestic hunger policy. I wanted to introduce first Emily Ersick. Emily is our coordinator of our Zero Hunger intern program. That is our summer program for interns in Washington, D.C. And we've just welcomed 14 or 15 interns, Emily?
15.
15, yes. And Emily is our coordinator of the program. She manages all the interns and their placements. She has a wealth of information about internships and what happens. And we're so glad to work alongside each other on these programs. Thanks for being here, Emily. If you have any questions about the internships, please reach out to Emily.
Yeah, thank you so much.
Next, I would like to introduce Minerva Delgado and Ellen Teller. There they come. Hi, welcome, welcome. We're so glad you're here this morning. Can y'all hear me okay?
Yes, thank you so much for the invitation.
Great, great, great. Well, I will let you all introduce yourselves, but I do want to just mention that today we'll be talking about domestic hunger policy. And for everybody that's logged in, you are in for a treat today. These two people have great information to offer us, and we'll be happy to answer questions. The format of the presentation today is that if you have questions, you can enter them in the chat on the side. And then at different points during the presentation, we will answer the questions from our community. So we're glad you're here. Minerva, would you like to start and introduce yourself and everything you do at the Alliance to End Hunger?
And let me first say hello to Ellen. So good to see you as always. And thank you, Liz and Congressional Hunger Center, for the invitation. And of course, welcome summer interns. We so rely on you, your energy, your enthusiasm, your expertise over the summer. And we just love having summer interns. We have a great summer intern in my office, David, so giving him a shout out, and just really look forward to working with you all this summer. So I am Minerva Delgado. I'm the director of coalitions and advocacy at the Alliance to End Hunger. Alliance to End Hunger is a national nonprofit. And I think the important thing to understand about the Alliance is that we are an alliance, we're a coalition. So we are a multi sector coalition, and our mission is to unite diverse sectors to address today's hunger and malnutrition needs, to solve the root causes of hunger, both in the US and around the world. So we work on hunger in the US and hunger internationally. And we are a multi sector collaborative of national nonprofits, corporations, universities, foundations, and faith networks of all kinds. So we're really thrilled that we have over 100 members. I think we're up to 108 members. And our advocacy work, which we're going to be focusing on today, is really driven by those members. So our Alliance and Hunger members, they meet and they really guide us in terms of what is the Alliance and Hunger going to be focused on, what are our policy positions, and then we at the Alliance create opportunities for them to get in front of decision makers, whether it's members of Congress or members of the administration. So my role is just helping to facilitate that, as well as overseeing our state and local collaborative. We call that the Hunger Free Communities Network. And that is working with about 50 organizations and coalitions throughout the country in 31 states that are working to end hunger in their communities.
Thank you so much, Minerva. That's wonderful. It's great to hear all that you all are doing. It's amazing work you all do. Ellen, how about you? Would you introduce yourself and tell a little bit about FRAC and what you do?
Sure. My name is Ellen Teller, and I am the Chief Government Affairs Officer at the Food Research and Action Center, commonly referred to as FRAC. Good morning, everyone. Good morning, Minerva. I think probably the most important thing I could say to all of you today is I, along with most of the lobbyists and public policy people in Washington, D.C., can trace our beginnings to internships in Washington, D.C. and abroad. The Coalition on Human Needs has an event every July, and we ask the policy folks in the room to raise your hand if you started out as an intern. So it is the pathway to greatness. Also, I think, well, let me just tell you a little bit about FRAC. FRAC started in 1970 as a part of a law firm working on the rights of people to access food and nutrition services in the country. And soon after starting in New York City, we moved to DC because we realized that the courts were only one way to work on the rights of people in low-income households. And we started a research arm, a grassroots arm, and a lobbying arm to have a multi-pronged approach to making sure that people had access to food in this country. I came along in 1986, which was probably before all of you were born. Started out as a legal services attorney, working on food law cases, moved into government affairs, never set foot in the law library after that. And I love the fact that we all, working in coalition with so many others, like the Alliance, can change policy, not case by case by case, but for millions of people with one stroke of a legislative pen. And that is the power of coalition work, and that is the power of working on a federal program in Washington, D.C. with the Congress.
Thank you. Thank you, Ellen. That's fantastic. So while we are gathering, I see more people are joining us as well. If you want to go ahead and put your location in the comments section. I always love to see where everybody is around the country. That's one of my little favorite things to look at. So would love to see that in the comment section. And again, if you have any questions, you can add them into the comment section as we go along, and then we'll reserve some time in the middle and again at the end for questions from our audience. So looking at the policies that are in place right now, and I'll pose this to both of you all, what are some of the top policies that you all are working on this summer that are affecting food security in our country? Minerva, why don't we start with you?
Absolutely. And I know Ellen will have a lot to say about this, but the number one thing for us is the Farm Bill, just like most anti-hunger organizations. I mean, this is the huge piece of legislation that impacts all of our work and impacts, so much of what happens in agriculture and the farm economy, but also for low-income folks who are having, trouble putting food on the table, right? So SNAP, which hopefully you're all familiar with, is authorized through the Farm Bill. And so that's in Title IV. The Farm Bill has 12 titles, and it's a huge, massive piece of legislation. We at the Alliance to End Hunger are most focused, like most anti-hunger groups, on Title IV, which is where we see SNAP and programs like TFAP, which is the Emergency Food Assistance Program, and that's how food banks get a big portion of the food that they distribute in communities out to communities, and a number of other programs, programs for seniors like the Commodity Supplemental Food Program, which provides vulnerable seniors with food boxes. So Farm Bill is where it's at, and we've seen a lot of activity in the last few weeks. The House marked up its Farm Bill. The Senate had put out the chairwoman's framework, and now the ranking member put out his framework. So we have both the Democratic and Republican frameworks out there now to evaluate and to comment on. So there's a lot of activity. So we're spending a lot of time on the Farm Bill. The other thing that we're probably spending a good amount of time on also is funding for the next fiscal year. So this is the time where Congress is looking at funding levels and really deciding on that. And so, of course, our coalition is weighing in to make sure that there's full funding where, to address the need that we see in federal nutrition programs. So I don't want to hog up this conversation. Definitely want to get Ellen in here and we can talk a little bit more about the details around Farm Bill, I'm sure.
Great. Thanks for that overview. I think the most important thing to communicate to you all about the Farm Bill, which is this behemoth, 11 titles, everything from forestry to climate to commodities to food and nutrition, is covered in the Farm Bill. The most important thing is no bill is better than a bad one. And because our programs, which are lodged in Title IV of the Farm Bill, are permanently authorized subject to annual appropriations, which means that the Congress does not have to authorize our programs every year and say, yes, we're going to continue running these programs in this manner for the next 5 years. We don't have to do that. The Congress has to pass those funding bills that Minerva referenced in order to keep the funding supply in the pipeline to keep the programs going. So some organizations who work on farm programs may argue that we got to get a farm bill done this year, and the goal is getting a farm bill done. Our message is we need a farm bill that protects and strengthens SNAP and the other commodity assistance programs. And we need a good, solid, progressive farm bill that first and foremost does no harm. So I think that's what you're going to hear throughout the course of the summer when it comes to Farm Bill. And there are always other pieces of legislation that could be floating around, but the eye on the prize is always the must-pass bills, and those annual funding bills are the thing that must get done, because if by September 30th, Congress doesn't take action to fund the federal government, there will be a shutdown. And some of you are old enough to remember when the Congress did shut down the federal government, and people experienced government in a lot of different ways. So if you had done your family vacation to a park and that park was closed, you were very angry at your government for screwing with your family vacation. So I think Congress, especially in an election year, is not going to allow the government to shut down. So these funding bills, and there are 12 of them that need to pass, can get grouped together, and Congress can say, we're going to do a continuing resolution. That means we're going to pass a bill that says all 12 subcommittee bills will be glommed together, and we'll keep funding them till a date certain in order to keep the government funded. And that date certain will be sometime after the election, when potentially a lame duck Congress will be reconvening back in DC.
That's good to hear. That's good to hear, Ellen. That gives me hope and faith that that the government won't shut down, because that is always in the back of my head. There's so much going on. There's so many layers to this, and it can be really complex to understand all the different parts and pieces. And I assume a lot of people on our call today already know a lot of the acronyms and so forth, but could one of you kind of give a broad brush view of what would happen if SNAP benefits were cut? I mean, how does that impact people day to day? And you mentioned, well, I'll just let you answer the question.
You're muted.
Let's see.
It's only a matter of time when someone has to be told they're muted, and I'll take the hit. There are two vehicles that are currently in Congress right now that could potentially impact SNAP, which is formerly food stamps, the largest of all the federal nutrition program. One is the Farm Bill, which Minerva described. And sometimes the way that Congress hurts and weakens programs is by cutting the program in a way that they use the savings from cutting the program and they use it to fund other priorities. And in the House Agriculture Committee bill and in Senate Agriculture Committee Ranking Member John Boozman from Arkansas's framework, both of those proposals and bills would cut future SNAP benefit adjustments. And you'll hear the word thrifty food plan. It is the basis by which USDA calculates what SNAP benefits will be. And this gets adjusted every 5 years, and Congress wants to stop future adjustments so that future SNAP benefits will not grow. And by clawing onto that funding, they can use that $30 billion for other priorities. And that is what has happened in the House bill and in Mr. Boozman's framework in the Senate bill. And what we are doing now is trying mightily to say no farm bill can pass with cutting future SNAP benefits. The other vehicle is the annual appropriations bill for agriculture, which got marked up last night, which would restrict what people can purchase with their SNAP dollars. And it also cuts SNAP's administrative funding. And oftentimes when you hear the term administrative funding, you think it's just, paper pushing. It's not. It pays the salaries of the people who determine eligibility for SNAP. And what we found during the pandemic, many people left the workforce at the state level, and a lot of them were people who did things like SNAP eligibility determinations. And when you see a shrinkage in the workforce, it adds to delays in processing SNAP applications. And that means that people are not getting their benefits in a timely manner. So again, we're always focused on how congressional actions at the very top federal level can have implications for households in communities across the country.
Yes, and I would just add to that because we're very much concerned about the same things, and the idea, if you ask the nearest SNAP recipient, they will probably tell you the benefit is not adequate. We know that right now, on average, people are getting, on average, on SNAP, $2 per person per meal per day. This is not a huge benefit. So for Congress to say we're going to cut future benefits by $30 billion over 10 years, I mean, this is a huge impact and will definitely hurt families and people who need this benefit desperately. If anything, we're trying to push to make the benefit a little more flexible to make sure that more people who need it are actually able to receive it. So we're pushing for things like repealing the felony SNAP ban. So if you have a felony drug conviction if you have a felony drug conviction, you're technically not eligible for SNAP. Most states have said that's not a good idea, and they've modified or eliminated that ban in their state. But it's still law. We would like to see that repealed. We're also trying to make sure that SNAP benefits can be used for hot and prepared foods. Right now, you can't use it for hot food. You can purchase the chicken in the freezer that you go home and cook, but you can't purchase the rotisserie chicken that might be available at that supermarket, which is going to save you a lot of time with your family, which is something that if a family decides that that's what they're prioritizing and wants to spend in my supermarket, it really isn't a big price difference at all, to go ahead and take that rotisserie chicken home and save an hour and a half that they could spend with their family, then that should be their choice. And so we're trying to make the benefit a little more flexible in that way. But no doubt, if some of the proposals go through now, as Ellen mentioned, there will be huge cuts to benefits in the future. But also people may find that they're restricted even more as to what they can purchase with SNAP benefits. And that's just not the direction we should be going in.
We've talked a lot about the Farm Bill and federal policies. Since, again, we're introducing a lot of these ideas to our viewers, can you talk a little bit about the difference between a federal policy and a state level policy? And maybe give some examples. I've been reading a lot about child nutrition and school meals. Are there some ways we can talk about those two types, state level and federal level policies, and how they impact food insecurity?
I can jump back in with what I was just mentioning, the drug felony disqualification and SNAP. So that is federal law, but there are SNAP makes opportunities for states to implement the program differently in certain areas. And this is one of the areas. And what we found is that right now, federal law says if you have a drug felony conviction, even though you've spent your time and you're now free, you're a returning citizen, you're not qualified for SNAP. Well, 27 states have said that's not something we're going to implement in our state. And another 25 states and territories have modified it. So they may say you're eligible to receive the benefit. However, you may need to take a drug test, just to while you're on the benefit. So they're not implementing the full ban. So I think that's an example where states have said, we don't like this policy. We think it doesn't make sense. And for many good reasons. First of all, when we look at this policy, it's unfair in that people have served their time. So why are we trying to ban them from receiving SNAP? Also, this has very negative racial impacts because we know that racial discrimination is very prevalent in drug arrests and drug sentencing. And so this kind of racial discrimination is now being carried over into SNAP policy because the people who are disproportionately impacted by this ban are African American in the US. And also, we know that returning citizens have twice the rate of food insecurity as their neighbors. And so this is the time when they're, being released from jail and trying to reintegrate into society and their families and their communities when they need the support. And so studies have shown that when returning citizens can access SNAP, can access other benefits, that they are less likely to recidivate. So we know that it's a policy that just doesn't make any sense. And luckily, states have said where they have the flexibility, yeah, we're not participating in that. There's only one state that has the full ban, and that is South Carolina right now. And so, but we just want to see this go away at the federal level. So that's one of the policies that we're arguing for, that we think, many states have made the change, and I think it should signal to the federal government that they should also make the change.
Absolutely. And in addition to state options, these are federal programs that are authorized at the federal level, but states implement the programs and are given some flexibility in how they administer them. So, for instance, child nutrition programs, there's federal nutrition standards for school meals. However, some states choose to implement them in a variety of different ways. Some states are now using state dollars to supplement the federal dollars to provide healthy school meals for all children. Some states take advantage of something that's called the community eligibility provision, which allows schools in areas with high concentrations of families with low incomes to provide meals to all children free of charge. So there are a variety of different ways that advocates can really work on pushing out and expanding access to many, many more families, children, and individuals by advocating at the local level. So there's work to be done at the federal level, making sure that we have strong programs, but how they get implemented at the state and oftentimes county and local school district jurisdictions provides ample opportunities for progressive advocacy.
All three of our websites have a lot of great information about what exactly advocacy can do and how to get started and so forth. And you lead me to a question that I'm always interested in, because I believe that as we advocate, having the facts in front of us is the best way to start a conversation at times. Can you tell us a little bit about how data is collected, and how do we know how many people are hungry in the United States?
Go ahead, Ellen.
I did it again. It's just noisy out there, so I keep muting. It's a great question, because data still matters, no matter what you think about untruths and falsehoods that are perpetuating out there in the media. Early on in my tenure at FRAC, the government did not have data on, back then it was called hunger, now it's called food insecurity. And so FRAC embarked on the Community Childhood Hunger Identification Project. It was a huge nationwide effort to train advocates in communities across the country to conduct surveys of folks who lived in those communities and gather information on hunger. And as you know, in this country, hunger is and food insecurity is very different than other countries. Hunger in the US is not caused by a lack of access to food. It is the lack of resources for people to go into markets and CSAs and other places to purchase a nutritionally adequate diet for their households. And so we undertook this effort, which nearly killed us, and issued reports on trying to document how many people in this country are at hunger or are at risk of hunger. And eventually the federal government took on this role. Why? Because people lobbied the Congress to give USDA the funds necessary to conduct these surveys and to do that. And it's a great asset for community leaders to have to understand what food insecurity looks like in their community, who is suffering from food insecurity and why. And as Minerva mentioned, the disproportionate impact on certain communities is palpable.
So we at the Alliance don't do independent research. We do rely on the USDA and that study. So thank you, Frack. And they do that study every year, and it is chock full of great information. USDA does a whole bunch of other reports as well. They recently came out with a report on the characteristics of SNAP households. They do all sorts of reports, and so they are a rich source of information. So we do rely on the USDA report, and they do look at food insecurity, which we should define. Food insecurity is at times a lack of access to enough food for an active, healthy life for all household members. And so, right now, currently, as of the last report, which is always a year behind in data. So in 2022, there were 44 million people living in food insecure households in the US, including 13 million children. As Ellen said, communities of color are disproportionately have disproportionately higher food insecurity rates, but other households also have higher rates of food insecurity than the average, like families with children, particularly young children. And so, like I said, that report has lots of information, but we also rely on many of our partners also put out their own reports. So for example, Feeding America just put out Map the Meal Gap, which is their study at, really at the county level of food insecurity in the US. One of their major findings is that 100% of counties in the US have food insecurity. There is no place in the US that we don't have food insecurity. And so this is, a nationwide problem that needs to be tackled. But also, one of the limitations of the USDA annual survey is that it provides data at the state level, but doesn't really isn't more granular than that. And a lot of our local partners say we really need a better measure, or we need a supplemental measure. And so Map the Meal Gap is very helpful for that. But some of our partners have taken it into their own hands to do their own local research. So I'm thinking of Indie Hunger Network in Indianapolis. They do a needs assessment on food insecurity for their neighbors in Indy. And what they do is USDA does put out sort of toolkits on how to measure food insecurity with the questions you should ask and how you should review that data and analyze that data. So they've taken advantage of that resource as well as some of the universities in their area to really help them come up with a local measure of food insecurity. Liz, you're also muted.
My turn. Sorry about that. Yeah, having so many sources is wonderful so that we can really aggregate the data and take a look at all of it. We talked a little bit about let's see, sorry. We talked a lot about the implications to different groups of people and different demographics. Can you talk a little bit about the importance of bringing people with the experience of food insecurity into the conversation and ways that you have worked with families or worked with people to help them become advocates as well as inform the conversation? Ellen, why don't you start? Oh, Minerva.
Yes, we that is such an important value for us, and we have an advisory council at the Alliance End Hunger. It's called the Hunger Free Communities Advisory Council, and these are people with lived expertise. As a matter of fact, we one of our advisors and I just spoke at the FRAC conference last week, talking about the importance of really bringing people who have firsthand knowledge of all of these federal nutrition programs to the table to be part of the solution. And it is, I think, something that's being understood more and more throughout the anti-hunger sector. So we started our lived experience council back in 2017, and it has really transformed our organization in many ways. Because we found such value in these voices and this perspective that it really has helped shape our policy agenda. And so, for example, maintaining choice in snack purchases is really something that they've been telling us is absolutely critical, just from a fairness perspective. And also, people don't want the government policing their shopping carts. They want to be able to make choices that of what they think is best to shop for their family when they go into a grocery store or farmer's market or wherever they can spend their SNAP dollars. And so we have worked, so within our organization, it's been transformative. We actually changed our board structure so that we can have people with lived expertise on the board of directors of the Alliance. That was never the case before because we are a membership organization. So in the past, our board members could only be representatives of those organizations. So, it wasn't, an omission that was purposeful, but that did omit people who are on, these federal nutrition programs, unless they're an employee of one of the organizations that we partner with, which is, usually not the case. So our board said we need to restructure ourselves, and they did that. We've really, the work of our advisors has really kind of rounded out a lot of our program work, policy development work, so that we're really thrilled about that. One example, I think I'll give two examples. One is there is a fairly new resource that was put out by Community Wealth Partners on sharing power with communities. And our advisors were featured in that. Our advisory council was featured in that. And it does give organizations some great resources and just a framework for thinking about engaging with community and some examples of how that can happen. So I want to point that out. The other thing is you all may remember back in September 2022, the White House held a conference on hunger, nutrition, and health. And I'm so proud that our advisory council was part of that event, one of them spoke on a panel, Dawn Pierce. Others were just part of working with the White House to make sure that the perspective of people with lived experience was included. And so, I think that it's become a really important value for us. We're talking to all of our partners about how they can best include these voices. And, I just can't say more about it. It's a reality check in the sense of, is what we're doing working in communities? Does it make sense to community members? And if not, then we need to be thinking differently about the work that we're doing. So it is very important for us at the Alliance, and we know at FRAC as well. So I'll let Ellen get in here as well.
Ditto. I think in probably the last 8 to 10 years, there's just been a great movement from what I call storytelling into real engagement and involvement with experts with lived expertise with poverty-related hunger. And I think that it is a dramatic shift in how the anti-hunger, anti-poverty organizations in Washington, D.C. function. And we get our grounding from the engagement of these individuals. And we just completed our anti-hunger policy conference last week. And not only was there engagement from a very strong component of folks with lived experience, they were compensated for their time. They helped select workshops. They led and participated in most workshops at the conference. And there was a recognition of their leadership in the conference. And I think that's just one example of how our movement has changed over time to really harness this engagement.
I agree. I see that, and I think a lot of people are feeling also empowered to contribute to the conversation that may not have before. And I think that's a wonderful thing as well.
And Liz, I want to encourage people to ask questions along the way. I'm sure you have questions or thoughts. So please feel free to tap into our psyches.
Yes, that you took the words out of my mouth. That was one thing I was going to ask folks to do too, is just put them in the comment section, and we can respond to them as well as we dive in a little deeper. One thing that we're looking at the Hunger Center is these reports and firsthand experience we've seen and heard from the youngest members of our demographics that are entering the workforce and in higher education, having so much trouble making ends meet with stagnant wage growth and housing prices and food prices. Are there any things that you're seeing with the Gen Z demographic working with your organizations, or things that you're seeing that we can highlight for our viewers online right now? So I don't remember, you are muted, but I don't know if you were going to jump in. Yeah.
So Congressional Hunger Center is a member of the Alliance and Hunger, right? And so when we look across our network, we see, many of our member organizations working with youth, and, we probably focus, in terms of this area, most on like college hunger and trying to advocate for better access to SNAP and resources, to address college hunger. But that's probably as far as we go. We do support our members who do a lot of work with youth, like National Farmers Feeding, FFA, Farmers Feeding America, and the Sodexo Stop Hunger Foundation has their youth engagement work. As well as, of course, some of our members are really advocating for children and youth, such as share our strength, that they're looking at those programs that really impact families with young children and as well as school age children.
Yes, and in addition to the substantive work, I think that just what you're doing here in terms of interning and doing your own research on the different organizations that work on anti-hunger, anti-poverty, poverty policy in the DC area is really important. And I will put on another hat in addition to my FRAC hat, and that is the Coalition on Human Needs, which is the umbrella organization for many, many, many of the anti-poverty organizations in DC. And if you're not on their weekly calls while you're doing your internship or getting their alerts, you should. Again, the Coalition on Human Needs, they work on anti-hunger, housing, healthcare, employment, education, just budget and tax, the whole gamut of issues that face households with low incomes. So I encourage you to do that.
That's great.
If I can also put on my other hat. I'm a board member of Community Food Advocates, which is a New York City-based anti-hunger nonprofit, and they have a wonderful example of youth development work. They have a group called Youth Food Advocates, and these are high school students who have been advocating for everything from universal school meals in New York City, and were absolutely critical in that win in New York City around universal school meals, as well as redesigning cafeterias in New York City, and are really on track to redesign most elementary and high school public school cafeterias in New York City, where it's kind of phenomenal the change that happens, where cafeterias are changed from this sort of industrial looking unappealing setting. I think back to when I was in high school and getting school meals, to something that looks more like a food court with small tables and food that's plated in a way that's appealing, and salad bars. And so Youth Food Advocates, it's just a great example of, youth advocating in their communities and being so impactful around food and nutrition.
That is a great example. I think too about when my kiddos were in elementary school and how much it had changed from the days when I was in elementary school, about the time that children have to eat, and how it's shortened. And I hear that from high schoolers and from college students as well, that just having a meal is so important, and then having the time to enjoy it. And I did not know about that, Minerva, about New York. That's so cool, because it seems like that would really help with the flow too. Yes.
We're so excited because the impact has been kids are eating more school meals and they love it. They love the food. I didn't have the heart to tell them it's the same food. It's just being presented differently. But they're eating more school food, which means New York City is bringing in more money, less food waste. The line goes faster. And there was a study that found better academic performance and less sort of disruptive behavior. Kids are eating. And, it makes a huge difference in their day if they're having a pleasant lunch that's nutritious and filling. So we're really excited about it.
It really does. That's wonderful. I'm looking forward to reading more about that for sure. I do have one more question about policy before we jump to our questions. Can you talk a little bit about some of the pandemic era policies that were in place that you'd like to see continued, or that you wish were still happening?
All of the above.
Yeah.
The most frustrating thing about working on anti-hunger policy is it is not rocket science. We don't have to create a drug or an inoculation to fight off hunger. We know how to eradicate hunger in this country. We've done it before. And so many of the pandemic era policies work. And we know that providing school meals to all children, regardless of income, we know that doing emergency allotments and giving every household on SNAP a huge benefit boost allowed them to purchase a more nutritious um, diet for them and their households. So Jim McGovern, the congressman from Worcester, Massachusetts, is fond of saying, all it takes is the political will. And that is true. In this country, if there was enough of a political will, we could eradicate hunger. And so many of the policies that were in play during the pandemic are exactly the policies we need to employ by providing meals to kids in and out of schools, providing families with benefit boosts. One policy that actually got continued past the pandemic is the summer EBT program. Since children were not in school, their families were given EBT cards with resources so that parents can go and purchase food to replace the school meals that kids were getting. And they found that this was very successful in helping families be able to fill that void. We had done pilots in different parts of the countries during the summer months when school is out and kids are not getting those breakfast and lunches. And this summer is the first summer that almost every state, and this gets back to what Minerva said, some states opted out of the summer EBT program. And you may wonder if the federal government is providing 100% of the program benefit, why would any governor turn down federal funds to feed children during the summer month when school is out? And I don't have an answer for you, but there are a handful of governors that turned down that money. And so we still have our work cut out for us to continue the work that was done during the pandemic. And it wasn't just SNAP and school meals. It was childcare, feeding programs that fed older adults. It was all the federal nutrition programs, each got a boost in their programs. And just about all of them ended when the public health emergency ended.
I think, and Ellen is absolutely right. And, but I do want to just kind of step back, because what this question is making me think about is, what are the root causes of hunger in the US, right? And so during the pandemic, our government said, wow, there's a real crisis. We need to help people. And one of the most effective programs wasn't even a food program. It was the child tax credit. So expanding the child tax credit. So this is, obviously a tax program, not a federal nutrition program, but that allowed families to have the income they needed to pay their rent and buy food. And it had a tremendous impact. And so, I think everyone understands that hunger or food insecurity, there's no one cause. It is really a symptom of all these societal problems. And lack of affordable housing is one of the biggest. And during the pandemic, there was a moratorium on evictions, right? And people got support through those pandemic payments, economic stimulus payments that helped them with rent and their other kinds of expenses. So we know that there's a severe shortage of affordable housing, right? About on average, Americans spend 33% of their of their money on housing. That was back in 2022. However, and this comes from the Low Income Housing Coalition, there are many households, particularly lower income households, that face what they call a severe cost burden to housing. And just just so you understand, 87% of low income households, that means households with incomes at the poverty line or less, are severely cost burden, meaning they pay more than 50% of their income on rent, right? And this is looking at renters. And so we know that that's a huge, driver of food insecurity, high housing costs. But there's so many other factors here. Disparities by gender and race in employment, wealth, and income, disparities in healthcare. And so look at the racial pay gap. There's always We've had a racial pay gap in this country forever. Even though last year it narrowed to the smallest margin that they'd seen since they started, I think, looking at this pay gap. It was still a pay gap of 82 cents to the dollar, meaning that for every dollar whites earned, blacks earned 82 cents. And so if you look at the working life of a person, that's a $300,000 pay gap over the course of a working life. So there's no one solution to ending hunger. Many of those pandemic, benefit programs really did help because they went to the root of these inequalities and got people the help that they needed. But now, unfortunately, we're back to business as usual with some exceptions, like summer EBT was a huge win for the anti-hunger community, for that to now be a permanent national program. And hopefully by next summer, all the other states that haven't opted in will opt in. But now we're sort of back to business as usual, where there is somehow, inexplicably, an acceptable level of food insecurity in the US, which we just think is outrageous given the fact that this is a problem that is eminently solvable if we put the resources in the right places.
And just a fine point on all of this, that summer EBT program was implemented. How was it paid for? In an end of the year spending bill, Congress ended the emergency allotments, that benefit boost to SNAP recipients, ended it early by a couple of months, and the savings that they were able to squeeze out of that went to a permanent summer EBT program. So sometimes these improvements don't come without a cost. And that is the way that Congress sometimes rolls. And it's hard to swallow sometimes those choices that have to be made.
That's a good point, but you're so right, and you're both so right that this is solvable. It really is, and that's what we need to keep working on and keep fighting for sure. We've had some questions in the comments, and I think we can take one now. Do advocates have to travel all the way to DC to meet with their representatives in Congress? And what opportunities for advocacy before lawmakers exist at the district, state, and local levels? I see you're shaking your head emphatically.
So, okay. I told you I started in 1986. I am old school. And I don't think anything takes the place of a in-person conversation. But as we see today on this, Zoom call, it is the next best thing to being there. And I think the pandemic ushered in a whole new world of communicating with elected officials and their staffs through virtual technology. I will just one quick caveat. I would say that the best thing, which is even better than coming to Washington, is getting Washington to come to you. And we always tell advocates, invite your members of Congress and their staffs. Invite all your elected officials, local elected officials, to come tour your agency, your program. Let them see what you're doing at the local level. Nothing is more powerful than that visual. So for instance, we do a lot of work in the summer meals program. And I love going to a summer site with a member of Congress. It could be at a park and rec, a municipal swimming pool, a library, a school, anywhere. And I just remember going to one park where they had baseball leagues going through the summer, and then they delivered the meals on picnic benches next to the baseball fields, and that's where the kids ate their summer meals. And this one member of Congress played baseball, I guess, in college, and he showed up to the site not in his suit and tie, but in his baseball uniform, and got out there and he umpired the game, and he loved it. And it was such a strong image of where kids should be during the summer months. And then he got to see the nutritious lunch that was delivered to those kids. Nothing is going to be better than that.
That's a great example. I love that. Minerva, were you going to add to? Okay.
To add, but yes, you find Congress takes a break during the summer. You can, go to their district offices and meet with them. You can, they also, look for town hall meetings and virtual town halls there. So sign up, for your congressperson's website for newsletters, and you'll find opportunities to meet with them. But if you feel strongly about something, plan a meeting, write a letter, there are ways to get in touch, and you don't have to come to DC to do it.
Those are great, great answers and great ideas. Let's see if we have another question. Emmanuel asks, most studies find that 30 to 40% of the food in the United States is wasted. How do you see the relationship between food waste and food insecurity play out with your work? And how should this be addressed?
Take this one. I mean, it is a huge problem in the U.S. And, we have a number of members who they kind of fill that gap. So Society of St. Andrews, for example, is a member of the Alliance. They do gleaning at farms and then donate that food to food pantries and soup kitchens. And then we have some members who do kind of like a virtual match. So, someone who has food that, it may be a restaurant, or it may be a grocer who says, I have some food that, I need to take out of inventory, but it's still good. They will then electronically match that person with a local food pantry, soup kitchen, food bank who can pick up that donation. So there are tremendous efforts to kind of make sure that food doesn't go to waste where possible. And this is also happening on a mass scale. So Feeding America, for example, which is the umbrella organization of food banks around the country, they have relationships with supermarkets who will say, okay, we have X amount of food that we're taking out of inventory, and then that will go to the nearest food bank. So these efforts are underway. What I think, we don't have a solution for right now is the food waste that happens, at someone's household, right? And so that, I don't know, I have the best answer for. But in terms of looking at farms that aren't able to, pick all their produce, or retailers and restaurants, I think that that work is underway and can be scaled up. But there are solutions that are happening.
That's great.
I think it's important not to lose our focus on the fact that food insecurity and hunger in this country exists because people do not have the resources to go into stores, farmers markets, CSAs, roadside stands, and purchase a nutritionally adequate diet. And that bumping up SNAP benefits and creating policies that provide resources into the pockets of families with low incomes is the focus. I think food waste, and we work a lot with different environmental, climate, and other groups, is really important. And there are baby steps being made in this area. And I will tell you a perfect example. It used to be in school meals that every child had to take everything in the school meal. They were not allowed to pick and choose because the nutrition standards were based on the meal and the totality of the meal. So the kid would take the apple, but he wouldn't, or she wouldn't eat the apple because they don't particularly like apples. Now they don't have to do that. Now there are tables in most cafeterias and childcare centers where children can put items that they don't want to eat, they don't like. They may take the apple thinking they're going to eat it, and then they decide they're full. They could put that apple on the communal table, and another child can come by and pick up that apple. We've also learned a lot about consumption habits of children over the years. And we've learned that if you cut up that apple, the child will eat the apple. But if you give them a whole apple, they would rather run outside and go play during recess. But if you give them a cut up apple, they'll grab it and they'll run outside and eat the apple slices. So again, really good research, working with different food and nutrition groups, talking at the community level about what works and what doesn't work. And an example of the conference we just had, people share best practices. You know, what is working in New York City versus what is working in Manhattan, Kansas. So I think the community is really good at sharing these practices.
Another good nod towards getting lived experience and asking people that are involved in the programs and in the schools how things are going. We have another question from our comments section. So we talked a little bit about advocacy on a local level, and I like the way you phrase this about putting pressure. What are some ways that are effective to put pressure on our leadership? Effective, and being the key word.
And your question is perfect, and your example is perfect. And I was just talking to folks in Florida. And in some of the states, the governor said no. And then because of pressure that the governor got, they reversed and got into the program this summer. So all effective advocacy is direct lobbying and engagement, having a media and a communications policy, having a grassroots policy. So whether it's, I was just a couple of weeks ago on the Upper West Side in Manhattan, staffing a street advocacy table. And we got local residents to write letters on paper plates to send to Chuck Schumer about bringing the child tax credit to a vote in the Senate. And people just wrote notes on the paper plates, and the West Side Campaign Against Hunger delivered them to Chuck Schumer's office. I've seen banners in senators' offices with little hand prints on it, thanking them from the Green Bay, Wisconsin Head Start Center for that senator's support of Head Start. So again, getting as grassy roots as you can and getting families to either have a town hall meeting and invite the governor to attend it, or having meetings or arranging a virtual meeting and getting parents to communicate to a local elected official, and start with your council representatives and take it up. Start with your school board members and then take it up. All roads lead to the governor. And then just have people talk about the struggles they have during the summer months when school is out, to provide not only meals, but coming close to the quality of the meals that people get through this National School Lunch and Breakfast Program.
That's great advice. Minerva, have you had some interesting examples as well?
The Head Start example, I think it's so important to say thank you. And I think that's what you were highlighting there, as well as saying, we need this or we want this, be sure to say thank you and follow up, when those members vote the right way or do the right thing. That's the only thing I would add as well.
When I first started working in DC with the Hunger Center, I had worked in food insecurity in Richmond, Virginia, and I see somebody else in the comments was from Richmond. Hello. But didn't really realize, how much of an impact things like that have. You wonder sometimes if your efforts are making a difference, but they do listen. And the staff that I've talked to on Capitol Hill say that those letters, those phone calls, meetings, they are noted, written down, and counted, and that makes a huge difference. Let's look for another question. Danny asks, how does an attorney intersect with the work, Ellen, that you do with FRAC?
So when I do panels on, especially with college students, people usually ask, do you need a law degree in order to be an effective advocate in Washington, D.C.? And I will be totally honest with you. When I graduated college in 1978, and then worked for Consumer Group in D.C. for a few years before heading up to law school, the two women who ran that organization, one was the executive director, the other one was the lead lobbyist, told me, in this city, as a woman, if you want to be taken seriously, you got to have a law degree. I am happy to report that it is no longer the case in Washington, D.C. Does having a law degree help me in my advocacy, help me in my writing, my analysis of legislation? I think so. It was right for me. I'm glad I went to law school. I always wanted to be a lawyer. I was involved in a couple of big cases, but as I mentioned earlier, flipped over to lobbying afterwards. I think nowadays, if people want to get a master's in public policy or other graduate degrees, I think those would be very helpful. But is it essential to the job? No. But I love having the ability, if needed, to put my name on a lawsuit if one needed to, sue USDA or be involved in an amicus brief or somehow work on other litigation. So it's good to have, but it is a commitment of 3 years of your life and a heck of a lot of money. So if you are going to do it, make sure you're doing it for all the right reasons. That sounds very motherly. I'm sorry, but that's my advice I gave to my kids, and none of them became lawyers. So,
well, I am not an attorney, although I do have a master's in public policy and have worked with many attorneys. I worked at Latino Justice, which is a civil rights law firm. And actually, one of the lawsuits that we brought way back when in the late 90s was to sue the mayor of New York City at the time, Giuliani, for denying food stamp benefits to people who are hearing impaired or do not speak English as a first language. And so work very closely with attorneys on that. So you don't have to actually be an attorney if you're, to kind of be involved in these things. I was involved as a policy analyst and an advocate that was working with the community that was bringing the issues to the law firm. And so, but yes, I mean, if you're looking to practice law, definitely would you recommend law school. I think for me, I got the public policy degree, which imparts, those critical thinking, writing, analysis skills that Ellen talked about. But I only spent, 2 years and probably a lot less money. So, I think that you have to figure out what's best for you and what you think, you want to do, but you don't need to be. I know many, many fantastic advocates who don't have any degree whatsoever. And so it really isn't necessary to do advocacy as a private citizen. And typically within an organization, it's not a requirement.
Here, here. I think we can say that everybody can be an advocate, and your background is not as important as what you're saying to the leadership. Let's go to another question from the comments. Jillian asks, what are ways that we can influence policymakers to see the value in anti-hunger policy? Who wants to go first?
This is where they really need to hear from people who are living with these policies. So for example, because they're the most effective advocates for why these programs are so effective and why they're so important. We have lots of research, and I can go in and spout all the numbers and the USDA report, the meal gap report, all of that, but I'm not going to be as impactful as somebody who says, this is what SNAP did for me. So that's my 2 cents on this. And I'll give you a great example. I was with a lived experience advocate in a meeting talking about the importance of WIC and fully funding WIC, which was a significant win we got out of the last budget battle. And in that meeting, she said, my WIC provider not only helped us with nutrition, of course, WIC does medical screenings for children. She's like, they diagnosed my daughter's disability before anyone realized she had a disability. And she just talked about the importance of having that sort of medical and nutritional support and what it meant to her family. And she had everyone in tears. I mean, and that's just one person talking about the importance of the program. So I think that to me is really key, not to underestimate what we do as advocates, but when you can have people who can speak to, that person who and lives in their community and says, I live in your district and I use this program and this is how it's impacted my family. I don't think there's anything more powerful than that.
Agreed. The only thing I would add to that is one of my favorite parts of the whole working in the anti-hunger sphere is coalition building. And none of us does this in a vacuum. Ellen going up to Capitol Hill on behalf of FRAC doesn't necessarily gonna sway things one way or the other. I'd like to think so, but not so much. But when Ellen Teller goes up with the representatives from, for instance, the American Academy of Pediatrics, talking about the better health outcomes for people when they get a benefit boost in SNAP, or when a child receives a nutritious school meal, or when a pregnant person gets the support and benefit from the WIC program, that is value added. That is a whole nother community coming in. So whether it's the healthcare community, the education community, the business community, when you are lobbying on an issue, and we talked about summer EBT earlier, if you're really going to work on a summer EBT campaign, make sure you are getting support from all those different communities and stakeholder groups in your area, so that when you go in to meet with elected officials, you've got a strong army behind you, advocating for those solutions.
It sounds like, so I loved what you said there, because I think sometimes people want to bring documentation or a person with lived experience to a meeting, but sometimes that's not always possible. But it sounds like you're saying it's equally as effective to have the information and those stories with you. Is that kind of what you're saying as well?
Yep.
Okay. And I might put you on the spot, Ellen, here, because and I hope we can pass and come back to it later. But Michael Wilson, who used to speak to this group as well, used to tell a story about a senior citizen, and it has stuck with me, but some of the details are hazy. Do you remember that story? And would you mind sharing it?
So that I do know that story, but I have my own story.
Okay.
I want to share with you all. And it was in my almost 40 years of lobbying. I still remember this situation. And interestingly enough, recently I had dinner with the Senate Hill staffer who was on the other side of this story, and he remembered it as precisely as I did. Okay, I will give you the Reader's Digest version. We were doing a farm bill. Saxby Chambliss, a conservative Republican from the state of Georgia, was chair of the Senate Ag Committee. We are in the hearing room on Capitol Hill. Sherrod Brown, great senator from the state of Ohio, said to Saxby Chambliss, for the Democratic witness, I don't want to have an expert. I want to have an actual SNAP recipient talking about her experiences on SNAP and what it means to her. Chambliss said, it's your witness, you decide who you want. So all the experts are there, and the GAO is up there, and people from think tanks are up there, and they're all talking about the details of the operations of the SNAP program. And this woman then testifies. Her 8-year-old or 10-year-old, I couldn't remember, son is sitting in the gallery with everybody else. And she's talking about that she's got a great boss who allows her to take time off for work, to go to the SNAP office for recertifications, because sometimes her income is higher or lower depending on how many shifts she works at the plant she worked at. But she said, of course, when I leave, I don't get, I have to sign out. So I'm losing money every time I go to the SNAP office, but that's what I do. And she said, and I have a choice now of feeding my child and getting SNAP benefits, or putting money aside for his college fund, which would lower my SNAP benefits, because at that time, money in a separate college savings account would count as a resource against your SNAP limits. Chambliss interrupts her and says, excuse me, we're talking about a separate, 529 account, which, there's a wall, there are penalties for taking that money out. That doesn't count against you. And she said, oh, yes, Senator, it does. And right now, it's more important for me to feed my son than him being the first in our family to attend college. What she didn't know is Saxby Chambliss's wife and daughter were educators, and he profoundly is a supporter of higher education. He turned around and said to Dave Johnson, who was his staffer, 2 words, fix it. 2 weeks later, Chambliss's marker bill was dropped. It excluded college savings accounts and retirement accounts from counting against SNAP resource limits. He really profoundly believed not only is a college education important, but that all people, including people with low incomes, need to save for retirement. What was stunning to me is I sat there in that hearing room and I felt that something profound was happening. You could just feel the buzz in the room that this woman who was speaking truth to power was getting her message across. And it was if those two were the only people in that entire room. And I always use as an example of how one person's voice changed the future of SNAP benefits for the over 42 million people in this country who rely on SNAP.
That I remember you telling that in another instance, and it is. It's just it gives me chills. It's incredible. It's incredible.
It was unbelievable being in that room and just sensing something was happening. And I ran into Saxby Chambliss at a reception years ago, and I'm like, "You are my example." And he goes, "That is a really scary thought, Ellen." I'm like, "You think it's scary for you? Imagine what it's like for me."
Right. So we have another follow-up question that's exactly along these lines from Raina. Regarding SNAP, where do you all see the intersection between the advocacy for benefits themselves and for income labor equity to increase means to access healthy food? Do you see Minerva?
I want to make sure I understand the question. Intersection between advocacy for benefits and our labor equity. Well, I mean, as I said before, we know that low incomes is one of the root causes of food insecurity, as well as sort of gender and racial pay gaps. So we need to work as a society, right? We need to work on these root causes while we make sure that there's a significant and robust safety net, right? So while someone is trying to work their way out of poverty, they should have access to these benefits that are going to assist them along the way. And one of the challenges that comes in is, and you may be referring to this, is what we call the benefits cliff, where, for once your income starts to go up, if it goes up above the point where you're eligible for the benefit, then you lose that benefit. One of the SNAP is one of the programs that's a little bit better on this, because as the income goes up, the benefit decreases a little bit, so that you don't automatically always get knocked off. But there does come a point where you're going to be above that income limit. Some states have, and Ellen may know more about this, but some states have done some innovative things to try to minimize that gap. But I think that ultimately it is a difficult choice that people have to make if they say, well, if I get X number more hours, I'm going to lose my SNAP benefits. And of course, they have to weigh, am I going to be getting enough extra income to make sure that, my family is better off overall? And those are hard decisions, and I can't sugarcoat that. We have been talking about kind of putting policies into place that would mitigate that, so to make it easier to be able to take those additional hours or additional income and still maintain somewhat of a benefit as you're kind of phasing off of it. You're muted.
Sorry. The only thing I would add to that is I think any responsible anti-hunger advocate would also be on the front lines of advocating for a livable wage and all the other supports that are needed, including childcare, healthcare, housing. I mean, just what is needed in our society to ensure that no one goes hungry, unhoused, unhealthy, just and all the other supports. And I think that for all of us, I mean, your income, your ability to provide for you and your household and your family is critically important. So I think that a livable wage has to be at the core of all of our work, because ending hunger in this country will not end poverty. But we know that hunger is a symptom of poverty, and that if people had the means, they would be able to afford a nutritionally adequate diet. And that is what is the barrier for people to get the nutrition they need.
Well said. Well said. I hope that answers your question, Raina. And if you have a follow-up, please put it in the comments. We've had a question from many times leading to conversations with family and friends. And I like to ask it of our speakers. What do you think are good ways, or how do you start productive conversations about hunger with friends and family, or people who aren't aware of the size of the problem in the U.S.? And Ellen, your smile is
Oh
maybe
gosh.
I want to go to you first. I don't know.
I pity. Sometimes I feel bad for the children of anti-hunger advocates. My kids are were fond of telling their friends, "You cannot come into our house and say you're starving, because my mother will bite your head off." I think that one of the reasons why anti-hunger work has been so satisfying to me is, I mentioned the coalitions that we were able to work with, and bringing in all these different stakeholders and being able to forge improvements in the programs over the years. The other side to that equation is, I love the fact that I've been able to work on food and nutrition programs that are probably one of the last bastions of bipartisan work in the US Congress. I try really hard not to have bills drop that are not bipartisan. So for instance, we just recently worked on a bill that would provide additional snack and meals to children who are on extended childcare. And we've always been able to get bipartisan support. And when I tell people that the original co-sponsor of that legislation was Bonamici from Oregon and Stefanik from upstate New York, they look at me and they say, "Really, Stefanik, the woman who Donald Trump is considering for his running mate on the ticket?" And I'm like, the exact same Elise Stefanik. So I think that when you work with different offices and find out where their interests lie and try to find a way to work in a bipartisan fashion, your success rate is much higher. So when we were doing an after-school meal program, and the subcommittee chair was Mike Castle from Delaware, who's a moderate Republican, his big issue with was teen pregnancy prevention. So we went in not talking about the benefits of a snack or meal after school. We went in with the campaign working against teen pregnancy, and let them open the meeting. And they said, Congressman, Mr. Chairman, peak hours for teen pregnancy are not after 10 o'clock at night. It's from 3 to 7 when kids are home alone and their parents are working. So if we had a meal program at the school and we compounded that with an activity or a program to keep the kids supervised and in school after hours, we think that will have a dramatic impact on lowering teen pregnancy in this country. And we got our after school snack and meal. My hope is, and I know teen pregnancies are down in this country, and heck, we're taking responsibility for part of that.
As you should. As you should. Minerva, what are your thoughts on difficult
Those are,
conversations?
yeah, I love those examples and ideas. And I think the teen pregnancy example kind of gets to what I was thinking, which is I typically don't start with hunger, right? I mean, there are facts that you can gather in your community so that, you can share those with folks, number of people who are food insecure. But I think it usually is most effective is if it starts with a conversation around the true cost of living and in the community, like this is the cost of living where we live. This is how much housing costs on average. This is how much food costs on average. This is how much all transportation costs on average. And there is a great resource that I always point to, and hopefully they've done this study in your locality, called the self-sufficiency standard or the true cost of living, depending on where you are. And usually they'll tell you what the cost of living is for the average family just to make ends meet. And people are usually shocked, or if they're one of those families, not shocked, how expensive it is. And I think that's usually kind of the door to open around this conversation. And because cost of living is so high, and we have lots of families in our community who aren't making the wages or have the resources to really manage this, there's lots of food insecurity. Like that's usually kind of, I think, a good way to open the conversation, because typically, again, hunger is a symptom of, lots of other issues. And if you can get some agreement that cost of housing is really high and there isn't enough affordable housing and public transportation and the other resources that we need to live, then it's not a long journey to understand that there are people who are food insecure in the community. And again, the Map the Meal Gap resource is really helpful and shows that there's food insecurity pretty much everywhere in the US.
So true, so true. So I want to take a moment and pause here. I have another burning question that I want to ask both of you. But being a little bit of a data nerd and also wanting to get some feedback, I'd like to take a moment for our guests to fill out our survey about our session today. So I'm going to pause for about 2 minutes. I'm going to put up the uh, let's see if it'll show up. Hello, there it is. Nope, didn't do it. Let me try again. There it is. Yes. So just take 2 minutes to complete our online survey about our session today, what you liked about it, what you wish we talked about maybe for future conversations. And just go ahead and do that for about a couple minutes, and then we'll come back and wrap up. Okay, I hope everybody had a moment to at least start the survey and maybe finish it if you didn't already, but we would love to hear back from you. This really informs our future programs, and we'd love to hear what you have to say. So we have one more question, and I know that all three of us have a hard stop at 1 o'clock, so we might end just a few minutes early with that. For Ellen, you said being an intern is the pathway to greatness. What are some recommendations you have for summer interns to get the most out of their experience in DC? And Minerva, I want to hear your answer as well. But we'll start with Ellen.
So it's not just DC. I will tell you, when I interviewed entry level people coming into FRAC for positions, my stat question is, besides getting good grades, what did you do in college? I am interested in where you volunteered, what you did. It's not just your summer internships, it's what you did in college, what activities you were involved in. I want to know what your interests are and that you're an energetic, well-rounded individual. So for instance, when I was in college, I volunteered in the Legal Rights Guild, and we did a lot of landlord tenant work. And I did intake at the Legal Rights Guild, and I got to see the lawyers work, and I got to hear issues that people were grappling with. It helped ground me from the sort of bubble that I lived in on campus. A lot of people get involved in campaign work. A lot of people get involved in a whole host. They're involved in student government in college. I want to know that you did more than, your head in the books. It's important to get good grades. Here's your mom talking again. But in addition to getting good grades, tell me more about who you are and the person that you are. And I remember reviewing the Congressional Hunger Center Emerson fellowship applications. And they would be all over my kitchen table. And I would look up at my husband and I'm like, some of these people, they didn't volunteer in the local, food pantry. They created the local food pantry. They led the, protest at the state capitol for, X, Y, and Z. These are people who are like doing unbelievable things in college. And that's what made them great Hunger Fellows. So I think getting out of your college bubble, and while you're up at school, and I don't care how rural or how far away, there is something for you to do on campus that demonstrates you're about repairing the world.
That's great advice. Minerva, what do you think about getting the most out of their experience in DC?
Well, I did not have the experience of being an intern in DC. I didn't get to DC until much later in my career. But I did do an internship between high school and college at it was a civil rights organization, but that focused on research and analysis, and because that's where my passion lay. Um, and there was so much I got out of that, but mostly I got the relationships. I got relationships that led to future employment, led to really deep long-term mentorships. So this summer is not just about your assignment, but it's also about building relationships, not just with the people that you're working with, but with other summer interns. Find people who are passionate about the things that you're passionate about. I think it's such a great opportunity. And DC is a fantastic city to be in. Take advantage. There are free museums. There are so many wonderful events going on all the time, whether they're social or educational. so I think, explore DC, take advantage while you're here, if you're not from here, to really learn about the city and get to know all of the wonderful things that happen here. One of the other great things about DC is that it is a very international city. So meet people from different cultures, different parts of the country, different parts of the world. I think that that will definitely enrich your life. And what I have found, I agree with Ellen that it's important to show your passion through whatever it is. It doesn't have to be anti-hunger work. Maybe it's the environment or something else, but make sure that you have a passion project, in addition to your academics, because we want to know what you're passionate about, what you care about, want to know, what excites you. When you work on something that you're passionate about, it doesn't feel like work. And I'm paraphrasing, I don't know where that quote came from. I've heard it a million times, but it is true. I love my work. I love the people I work with. And as frustrating as it can be sometimes working with this Congress and, some of the challenges that we've talked about, it is a fantastic group of people doing really important work, and that fuels me personally. So, I've been at the Alliance to End Hunger for 9 years. Um, and it's because I work with a great group of people and we're doing things that we all feel very strongly about, and we really enjoy each other. At the end of the day, we're human and we need to be in an environment that feeds our souls, that, and for me, part of that is making sure that the work I do is meaningful. And for me, working on hunger issues is meaningful for me. So find the thing that's meaningful for you, and maybe the summer internship will help you narrow that down. It took me a very long time to get to the space where I said, okay, this is it. I worked in a variety of different issues. I worked inside of government, the private sector, at nonprofits. I've worked as an organizer. I've worked as a policy analyst, as a program manager. I was an executive director at one point in my career, and said, that's not really what I want to do. That's not where I want to spend my time reporting to a board. I want to be with people, building coalitions and advancing policy. So find the thing that you're passionate about, and hopefully this summer will help you do that, in addition to enjoying the nation's capital, which has a lot to offer.
You answered one of my quick questions too, Minerva, and I agree with everything you both said. Was how to keep going in this frustrating system, how to keep a positive attitude, and I think you answered that well, Minerva. Any tips from you, Ellen, about how you keep going and with all that's faced and all that we're faced with? Oh goodness, we're on mute again. Last time. I think you're muted, Ellen. I can hear you. There we go. We got it. Okay, I might have to call in my backup team. I'm not sure about that. Maybe. Oh no. Let's see. And now I can't hear.
While Ellen's trying to find the mute button, one thing I do want to say about this as well, in terms of like, how do you keep going? I've worked in both direct service organizations, food banks, for example, giving out food, as well as policy organizations. Right now, I work in a policy organization. But for those of you who are interested in policy, I will say the value that you receive from doing some direct service work or some, direct action work, community-based work is invaluable to understanding how policy plays out in communities. So I suspect many of you, because you're in DC, are probably very interested in federal policy, but don't discount the experience of having some direct service work. That really, it was interesting when I applied for the position at the Alliance. It was not my previous policy work and civil rights work. It was mostly my direct service work that got me that position, even though it was a policy position. because they wanted to know that I understood the struggles of the organizations in our membership, many of whom are direct service organizations. But you get a very different psychic benefit from direct service work. You help individual families, and when I was running a food bank that had a food pantry associated with it, every day I saw families that got help, and that was it was so inspirational, like just to know that every day we were helping families. Then when I stepped into the policy space, you don't get those psychic benefits in the same way, because every day you don't see that fact that you're helping someone. But when you get a big win, like fully funding WIC for this fiscal year, and knowing that all of those families who need WIC are going to get it, that is, you do get that satisfaction. So it's fewer and far between, but if you can find ways, the way, I did talk about loving my work and my coworkers and the community I work in, and those are things that feed my soul. But there are different ways to get that psychic satisfaction, and you need to know what does it for you. It may be direct service work. It may not be policy work. And maybe then if you're doing policy, you may have to have a passion project that's really more related to helping families every day.
I'm back. I had to re-enter again. I'm sorry. It's like anything in life. You can just white out the date and just do the same thing over and over and over again, or every day you can approach your job and your passion and your sort of your mission with an energy that is always looking for ways to do it differently, to improve on what you've done in the past, and to look around the room and say, who's missing? Like, who else should I be working with? And I just remember on the last child nutrition reauthorization bill we did, we had this enormous coalition. Room was packed. And we looked around, and the first question I always ask is, who's missing? And at that time, it was oral health. There had been a tragic situation in the District of Columbia where a young boy had gotten an infection in his gum. The infection went to his brain and he died. And that was because his family lacked access to good oral care. And then we found out that there was an organization, national organization for oral health, and it was called America's Tooth Fairy. And we started working with America's Tooth Fairy. And they had little kids with wings and wands delivering messages to Congress on the importance of good childhood nutrition programs. And the message was on their wands. So kind of made for a kind of a light, fun experience doing a lobby day with them. And it was great.
I love that. Those are the things that keep us going for sure. Oh gosh, this has been great. I could spend another hour talking. Thank you, Minerva and Ellen, for your expertise, your guidance. We are appreciative. And if we have any additional questions, I know we'll share your websites and so forth, so we can follow up. And thank you again for your time. I appreciate this.
And we'll see you guys tonight at the Congressional Hunger Center Awards.
Right.
Thank you.
Busy day. Thank you again. Thanks everybody for joining us. Have a great
Good seeing you, Manara. Bye-bye.
Wonderful summer.
Thanks again, everybody. Have a great rest of your day. Bye-bye.